Hello everybody, this is Dr. Vittorio Puente again, and today I'd like to share with you a story that's related to a problem that I find it's important to talk about. And this problem is how we as patients communicate with our doctors and how certain treatments are unnecessary, and because medications can toxify the body, can lead to additional problems. And those problems have a domino effect and can cause discomfort in life. Well, the story is one patient was treated as an older adolescent for psychiatric issues, and these psychiatric issues were related to irritability, obsessive thinking, and psychiatrists tried many medications in order to manage it. And the psychiatrist went through, let's say, about 12 medications, and there was no toxicity. There were no lingering effects, which is fantastic news, because, as I mentioned before, some medications can have a quick toxicity, and all medications have some form of effects that are not directly related to the reason of taking that medication. But this particular patient did pretty well. So after a while, the patient experienced some discoloration on his skin, and this discoloration didn't really cause him much concern. He really didn't care one way or the other about it. But one of his doctors said it was probably important that he look into it. So he was sent to a specialist, and this specialist wanted to do some treatments. And the treatments included topical creams and pill form. His primary doctor was against it. Also asked, "Why are you taking this kind of treatment? You don't really care about it." But he felt that he did not want to cross that particular doctor, and so he continued with the treatment. And after about a year, the treatment didn't do much for correcting his discoloration. At one time, however, when he was getting some blood work, it was discovered that his thyroid was significantly out of whack. It was producing way too much thyroxine, and that kind of production could cause a problem. It was recommended to him, based upon that report, that he have surgery to burn off the thyroid gland. At that point, he was only taking a couple of medications for his psychiatric issue. But because they eventually burned off his thyroid, he had to take a medication for the rest of his life, mind you, to help to give him the hormone that he needs. So, at that point, when he started taking Synthroid, it's a medication for the thyroid. It substitutes the thyroid in its production of thyroxine. So at that point, he was weighing within the normal range. Well, he's probably a little overweight at that time, but over the course of years, he started to gain more and more weight. It didn't seem like there was much being done to help him regulate his weight. And being obsessive in his own right, he started having some more issues. What happened then is he started gaining weight. His body had more and more difficulty getting the weight down. His metabolism lowered. His blood pressure went up. He had more cholesterol in his system, and those two, of course, require medications. So now he not only had Synthroid, but he had two other medications to help manage these two other issues that were directly related to his weight gain and were related to losing his thyroid. Now, the weight gain got to the point over time that he was having a little more difficulty managing. He went into a job and he injured his back and he injured his knee. Then over time, so now he was not only overweight, he's carrying an injury on his knee and his back. Well, this, of course, complicates much of his life, and over time, the injury needed to be taken care of. He had surgery on his knee and he had surgery on his back. But his weight was still an issue, and he had gained over 60 pounds. Traditional methods were not sufficient to get his weight down, and so what did they do? Prescribe a medication that was off script. So the medication was not directly related to his issue. It was related to something else, but it also had these qualities that helped him lose weight. And the medication was called Invokana. Invokana is used for diabetes. And prescribing the medication, he started to lose some weight. He lost about 12 to 15 pounds. And he started to feel better, but he started to have significant pain in his pancreas. He was prescribed medication in the past because of his knee and his back pain, but doctors now, I'm thankful to say, are less likely to prescribe a medication with codeine or an opioid base. So he is prescribed this other medication. So he had to go to the hospital. He had to be looked at for a couple of days because his pancreas was inflamed and it was causing a lot of pain. They assumed that he was a drinker, which he definitely isn't. And he was told, you should not take that medication off script. You do not have diabetes. You should not take that medication. So they got him off that medication, still having pain in his pancreas, and they prescribed a pain medication. So now he had these 3 other medications. He had medication for diabetes, which he doesn't have, and then they take that one off. In order to treat the pain, they prescribed something else. So now he has more medications. When you look back from the very beginning, getting rid of his thyroid was the initial cause of it. And getting rid of his thyroid was linked to the addition or the presentation of different kinds of medications to treat an ailment that did not have any long-lasting or immediate impact on his life. He didn't care. So now he's taking a medication for pain. And after a short while, the medication starts irritating his stomach. Remember, he's been taking a lot of medication over time. So at this young age, his stomach is reacting. So he's producing way too much acid that's causing some significant issues. Now, I did not mention that because of his weight gain, he has trouble sleeping with sleep apnea and he requires the use of a CPAP machine. So now we've got 8 different treatments. So all of these treatments, none of it includes modifying his diet. Until now, there's a lot of more talk about modifying his diet, which I had been speaking to him about for many, many months. So then what is he supposed to do? Well, the story doesn't end there. They got him off that pain medication, and now he's prescribed an antacid medication. So the antacid to treat his stomach, which is producing way too much acid. So that's where the story had ended. So the words of wisdom for today is, if their medication is not something to be messing around with. It does toxify the body. It causes a person's quality of life to diminish, or it can cause death. With this particular patient, prescribing Synthroid for the thyroid is appropriate, but how did it get to the point where the thyroid had to be destroyed? And then there's a series of cause and effect that happens afterwards. For you then, the word of wisdom is, if you don't need to take the medication, don't take it. If the treatment is not necessary, or if there is a less invasive alternative, take it, try it. If the issue is not acute, that is, if you're not having a ruptured spleen or your appendix isn't about to burst, try to find alternatives in changing your lifestyle. With people who actually do have pancreatitis, for example, or gout, there is lifestyle changes that will minimize the pain of the pancreatitis, or the pain that builds up with the buildup of acid in one's blood and joints. And that is modifying your diet, modifying your lifestyle, walk a little more. So with this particular patient, modifying his lifestyle was an important and a significant step that needed to be done. And thankfully it has been done and been done successfully. So, now if you have any similar stories about how a treatment led to additional multiple treatments, please share it with me. Go to my webpage or here on YouTube, on the comment section, write out what has happened to you. I'd be interested to hear. So until next time, be safe and watch what you eat.